Welcome to Moms of the Lou podcast, hosted by and recorded for St. Louis moms. Grab your laundry basket, kick your feet up for nap time, or head out the door for pickup and spend a little time catching up with your favorite St. Louis moms. Hosted by a fellow St. Louis mom, Rebecca Coast, let's dive into our discussion today. Hello, St. Louis moms. Welcome back to another episode of Moms of the Lou. I am so excited today to be chatting with one of our contributing writers for St. Louis mom, Yasmine Fehr. We are going to be talking about all things related to mental health in our kiddos, especially as we think about heading back to school. This episode is presented by Siteman Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine, national leaders in cancer. Welcome, Yasmine. We are so excited to have you on the podcast today.
I'm excited to be here.
Wonderful.
Yeah.
Okay, well, I would love for you to tell us a little bit about yourself.
Sure. So
your family, your job.
Absolutely. So my name is Yasmine Fehr. She said I am a psychiatric nurse practitioner. So I specialize actually in working with mental health and mental health professionals, and I specialize in pediatric and adolescent psychiatry. So I currently work for Cardinal Glennon. It's awesome. I do outpatient work there, and it's a wonderful, wonderful place to work. In terms of just a little bit about me, I'm actually born and raised in Memphis, Tennessee.
Nice.
So I am a transplant. Although now I think now I can say I'm officially from here because I've been in St. Louis longer now than I have been in Memphis. But that was where I grew up, and I came here for school, and just I was sucked in. St. Louis kept me.
Sucked you in.
Sucked me right on in. So in terms of my family, I have my husband, Chris, who we've been married for 8 years and been together for 12. And we have a son, Samuel. He is 20 months old. So really fun age.
Yes.
He's got a lot of opinions lately.
Yes.
But it's awesome. And we have our first daughter, as we call her, our dog, Whitney B. So it's just our little collective family. We are only going to have our one kiddo, and that's it. So we live in Ellisville, and we just love hanging out at home. We're just homebodies. So.
Homebodies.
Yeah,
I love it.
Homebodies.
Big homebodies.
Big homebodies.
Okay.
So, yeah.
And does Samuel rule the roost right now?
You know, he does. I would say so. He's pretty clear about it. And it's so cute because he really wants us to always be together. Like if I'm sitting on the couch and Chris is sitting on the couch, he pulls both of us together and we have to hug together. And you can just tell it's just a very cohesive little family situation. So he tells us what we need to do and make sure we show each other affection. It's very cute.
And you follow in line.
Yeah. Yes, exactly.
Yes.
I fall right on in line.
Yes.
I'm like, look at this little 20-month-old kiddo ruling my life. Who knew?
All right. Who knew?
Knew.
We were so naive.
Exactly. I said no man was going to control me. But look at this. Look at what's happening.
This.
Look at what's happening. And I'm okay with it.
I love it when they're at that age that they start to kind of piece together their world, and their family, you know, and their place in
Exactly. It's awesome. It's wonderful.
That's awesome. Okay, so you're a St. Louis mom.
Yes.
Give me your top 5. It could be place to take your son, place to go on a date, mom's night out.
Gotcha. So like I said, right now, these days, my favorite spot is in Ellisville, in my house.
In your couch.
On my couch, right. However, when I do get an exciting little piece of energy, well, Cooper's Hawk is one of our favorite spots.
Oh, yeah.
I love it. Actually, just made a reservation for us to go next weekend. So I love Cooper's Hawk, wine club member for sure. Nice. And then I love Forest Park. I haven't been able to venture out as much as I'd like to there, but it's where I went to. I went to college in that area, so I love being there. We took a lot of wedding photos. I got married there.
Aww.
It's just very much a part of my past and just tradition and all of that. So I love Forest Park. In terms of other places, I love going to just parks in general with Samuel. He's at that age where I'm just trying to get him to explore and walk around. And shout out to St. Louis Mom for the splash pad. Roundup, because that's exactly where I went to make sure I knew where to go. So we love to do that. But I don't know. I'm kind of a boring person. I like going to the pageant
Oh,
for
fun.
shows.
Okay.
I love music. Music is a
Yeah.
thing.
Okay.
I love music festivals for sure.
Ooh, okay.
I really miss Lou Fest because that was like one of my favorite festivals here.
Yeah.
But love going. So pageant for certain performers
Okay.
and performances.
Yeah.
I really prefer kind of the smaller venue in that situation. So definitely a big one there. So yeah.
I'd love to hear that. I
yeah.
feel like we don't. It's a little bit of a lost art these days,
Yeah,
going
yeah.
to see live music. And
Yes. That was a big part of my childhood. My dad was very much into music, so
Yes.
that's what we did. We went to concerts together, and I just love that. So definitely want to share that with Samuel too,
Love that.
Yeah.
Love that.
yeah.
Okay. Well, let's get into our topic.
Let's do it.
It is important. And
Mhm.
so you are a pediatric. You say it again. I don't want to
Okay,
get it messed up.
that's fair. So, because a lot of people are like, okay, what do you do? Like,
Yes.
what does this look like? So I am a nurse practitioner in psychiatry.
Okay.
So that means I prescribe medication. My main goal or my main scope of practice is prescribing medications.
Okay.
So I prescribe psychiatric medications, but I subspecialize in working with pediatric and adolescent clients. So I am certified to see the entire lifespan. So I could see adults, I could see older adults, et cetera. But life has led me to working with children and adolescents. That's my ministry at this point, for sure, because there's not a lot of us out there that are working with the kiddos in this regard. And there's a lot of need for it at this point. So, yeah.
So what kind of an age range? Are we talking like preschool, toddler till like college, or what's the range?
So the range where I start is usually anywhere from like kindergarten to up to 21.
Okay.
So I see that's a huge amount of development there, right? That's a lot of like fluid motion because when you look at the adult population, there's some fluidity there, but not a lot, But when it comes to development and growth and all of that, it's a lot of nuance because I'm seeing elementary age kids, I'm seeing teenagers, I'm seeing people who are just moving right into young adulthood, but are still like on the cusp of still being a teenager. So it's definitely quick. You got to switch it up quickly to understand the different kind of stages.
Yes.
Yeah.
Whereas like with adults, maybe it's more of like kind of, self changes or self-reflection versus with children, it's like cognitive development, right?
Yes. We're still dealing with underdeveloped brains at this point.
Absolutely.
Of course, bodies, but brains in particular. So, there's a lot of room to kind of create these pathways for these kids to be kind of these fully functioning, very successful adults, and which is why working with children, I love it because you have some early intervention. You have opportunity for early intervention in ways that you don't always when you're working with adults, and we're kind of trying to untangle some learned things and learned behaviors, Yeah.
Oh man, your job is so important.
Yeah.
Okay, so I mean, I think it's no secret that our kids are probably more in distress today than they've ever been.
Absolutely.
We see that kind of across the board in so many ways.
Yeah.
Living through a global pandemic didn't help.
Correct.
It did not help at all.
Not at all.
But from your perspective, seeing so many, kiddos, what do you think are the greatest challenges that our kids are facing today regarding mental health and maybe the causes?
So I have to tell you, my lens is going to be through, I'm reading this book, and a lot of you guys may have heard of it. It's a bestseller right now called The Anxious Generation. It's by Jonathan Haidt. And he is a social psychologist. So he's talking about why is our generation so much more anxious when we compare it to others, like our kiddos. And a big factor that when I look at like, when I grew up, I'm an 80s baby. So when I grew up, and I think about some of the challenges growing up, biggest challenge or biggest difference is access to technology and social media. I don't think it's going to come to anyone's surprise that those are the biggest and most predominant factors that were not present when we think about previous generations and exposures to childhood, I mean. So yeah, I think that's the biggest challenge. But I think the thing that we have to also keep in mind is that mental health we didn't just start having mental health issues with children. We are being much more vocal
Yes.
about it now. Because I think about when I talk to my parents and get their history, when I'm, interviewing kids and evaluating them, parents are telling me like, yeah, I have relatives that have mental health issues, but, they don't talk about it. Or I had ADHD as a kid, but, they just thought I was just a hyper kid. We didn't, there was a lot of, we're not talking about it, or it's just, it's fine, it's fine, it's fine. So mental health issues have always been a problem for children, but we're just actually having these conversations about it. And now we've got some other compounded issues that we got to look at too, because we have to ensure these kids are safe. So other things that are just world events in the state of where we are in the world, it's unfortunately school shootings, things of that nature, a lot of those types of very catastrophic things that are pervasive right now in our society. These are some things that we didn't grow up with to this level. So there's a lot more heightened, there's just a lot more going on just universally, honestly.
Yeah. And kids being exposed to it
being more exposed
from
being
an
aware.
early age.
Yeah, exactly.
Do you find obviously you're coming at it from a clinical perspective, but then just you as a mom in the world, right? Out there with mom friends and in circles. And do you find that there's the stigma behind mental health issues is decreasing?
Yes.
That we are getting more to a point that people are more willing to discuss it and feel comfortable doing that?
Absolutely. I really do. When I first got into doing mental health, that was the whole reason I wanted to do it, because I wanted there to be some destigmatization of mental health in general, especially me being an African-American woman, in our community, it's not always discussed or really confronted. And I really wanted to kind of be someone who helped to destigmatize that, as to have these conversations. And I am seeing it's much more of more people are open to having those types of discussions and talking through it, just from the mom level too. My kiddo is struggling, and finding comfort and support and community, and realizing that they're not the only ones dealing with those types of particular situations. So
that's good to hear.
It is.
That's good to hear.
That's definitely a positive.
Yeah. Okay, we are going to take a quick commercial break from our partner, Seinfeld Cancer Center, who we work with in several different capacities. Our mission together is to spread cancer awareness information and education to our St. Louis mom community and beyond. Together, we educate our community about all different kinds of cancers and how they can decrease their risk through using sunscreen, encouraging women to get mammograms, eating cancer-fighting foods, and so much more. They launched their very own podcast called This is Cancer last year, and their third season recently launched on July 24th last month. Let's hear more about it.
Hey everybody, Laura and Patrick here, excited to announce another season of This is Cancer.
That's right, we cannot wait to bring you more uplifting stories from the patients at Seinfeld Cancer Center and the Washington University physicians who treat them.
I knew, I felt comfortable right away when he said, I'm going to make you better, and this is a good team.
Oftentimes people around us think about that gratitude or let's celebrate and don't pay as much attention to the longer term kind of emotional effects of cancer too.
One thing that I've learned from this experience as a caregiver, please don't shame or judge yourself.
No matter what the situation is, there's always something to be grateful for.
If there's anything wrong with your body, if you feel like you should wait, don't. I don't care how important the sports is, how important this event is, you should get it checked out.
Look, my hat goes off. My hat goes off to you.
Oh my gosh.
For doing what you do and doing it every day and doing it with grace and humility. And I am so happy to have you as my physician.
Season 3 of This is Cancer is brought to you by Seinfeld Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine in St. Louis, national leaders in cancer.
We're premiering July 24th, wherever you listen to podcasts and with video on YouTube.
Okay, thank you to our episode sponsor, Seinfeld Cancer Center at Barnes Jewish Hospital and Washington University School of Medicine, national leaders in cancer. Let's get back to our episode. We talked about, the presence of technology and social media as kind of an issue that wasn't present in the past.
Yeah.
That's, threatening our kids' mental health.
Yep.
So I want to talk about some kind of tangible signs
Mm-hmm.
that a child might be in distress
Mhm.
mentally.
Mm-hmm.
And I'd love, any kind of information that you can give us in terms of age breakdown
Yeah, yeah.
would be really helpful.
Absolutely. And I wrote about this too, just,
Yeah.
just to refer. So if people want to go back and look at it in writing,
Yep.
I wrote a blog post about how to really know if your child is going through some distress.
Yep.
Because I think that's always the reigning question. It's like we have these conversations about mental health, but what does that really look like for me as
Yep.
a mother or as a caregiver who's responsible for seeing these things?
Mhm.
So the main thing is changes in functioning. That's when I look at like just a way to oversimplify it, it's changes in daily functioning. And one thing that I want to impart upon the moms listening is that I always tell my patients and their parents, I'm a clinical expert, right? I'm the one who knows clinically like the medications and things like that. But the expert on your child is you.
Yes.
And so I think because I run into some situations, I don't see it as often in the pediatric provider world, but I run into situations, but I see it where, parents will have a feeling about something and it'll get brushed off and your kids, we know our kids the best. Like I am a Samuel expert, right?
Yes, yes.
That's what I do know. I'm not an expert on anyone else's child, but I am an expert for him. And so change, what that looks like. Changes in day-to-day functioning that's gonna be your main thing. For younger kids, one thing I want to also impart is that anxiety and depression, which are going to be the most prominent types of, the most common diagnoses or concerns that parents would have, it looks very different in children than in adults.
Mhm.
Adults, we tend to have a very clear picture, like if someone's anxious, they are just like internally worried and shaking and, tremoring and things like that. Or depressed, they're super withdrawn. They don't want to talk to anyone. They're isolating, very sad, low moods. With children and adolescents in particular, when mood is not regulated well, they start externalizing their behavior. So you see more outbursts of anger. You see more like irritability. That's what it looks like in kids and adolescents when they're really struggling. It doesn't always look like that picture perfect, like withdrawn type presentation. So with younger kids, it's more outbursts because they're not able to verbalize how they're feeling. So I see a lot of avoidance of school. They don't want to go to school. They have a lot of physical complaints of stomach aches, headaches, and very vague, like nothing can be pinpointed. They don't want to go. They are having friend issues or issues at school socially that could also impact things. They're not eating well. You see changes in appetite, changes in sleep patterns, difficulty falling asleep, staying asleep. Those are all areas where it's like their day-to-day functioning. It's like when your kid is getting sick kind of thing.
Yeah.
You have that like prodromal phase of like, they aren't their energetic self.
Yes.
Like it's the same kind of idea when you're looking at children and adolescents. Teenagers also, we worry about them turning to substance use, vaping, really just wanting to like more defiant behaviors, things of that nature. That lets us know something is going on underlying. We see a lot more of that kind of externalizing behavior with the teens.
Yeah.
Yeah.
So what advice would you give moms? Because I'm sort of hearing that, they're, kids are also kids, right? And kids, like, I mean, they want to pull a fast one on you, if they want to like get out of school or, just being a kid.
Right.
And so it's like, how does a mom kind of discern like, okay, is this just my kid? Like, you know what I'm saying?
Right.
Kind of like
avoiding.
just avoiding or, just kind of trying to test the limits, push the boundary a little bit.
See what we can do. Yeah.
Versus like, when do we have really something that needs to be addressed?
Absolutely. I think also leaning into the people that also see our kids daily.
Yes.
That is, a lot of our kids spend a lot of time away from us, like whether they're in school or they're in daycare or whatever the situation may be. So leaning to those people too is very, very helpful of like, hey, are there things going on at school? That sort of thing. And then if it's persistent, I know some kids, we have those days where we don't want to go to work or we don't want to go to school. We have those moments. But when it becomes a persistent issue and it's consistently avoidance, even if it is a boundary testing, that behavior still has some sort of explanation or foundation to it. So we still need to understand, okay, what are we avoiding though? Are we just not wanting to go to school because of academic demands? Is there someone bothering you? You know, there's still some explanation to why the avoidance is happening, even if it is happening. Yeah. So just trying to get to the core of that is really going to be important. But if it's persistent, you usually see it consistently where it's like during the week, it's a lot of high anxiety, high emotion. Weekends, things are much better. And that's how you know something's happening at school. Up. Yeah.
Okay. So what are just some things practically that moms, you know, I think as moms, our tendency is like, well, what can I do? What can I do? What can I do to prevent? What can I do to help? You know, so what are some ways that moms can stay tuned in to their child's mental health?
I think just being open and having the forum of conversation and just letting your child speak to you and not have a lot of judgment. I think we have to figure out how are we presenting and showing up in these situations. Because if we're showing up with a lot of anxiety of our own, which is of course natural, that's what we do. We're going to be worried about our kids, but we want to present in a very non-confrontational, non-judgment way of talking through things. The other thing is also, you know, if there is concern, don't be afraid to reach out to, you know, pediatrician or doctor and talk through like, hey, I'm concerned about what's maybe going on. Yeah. They are now at a place too, even though they're general practitioners in pediatrics, they are also screening for mental health concerns because it's so pervasive. So they're going through their own screenings too to help to see, okay, are we identifying an issue here? You can always reach out to a pediatrician or talking to other mom friends, things like that. But I think just having that open forum of conversation is what is needed, because I hear from my kids on my caseload, they often feel like they're not being heard. When they do finally get to the point where they're seeing me, it's like it took a long time to get there because they didn't feel like their feelings were regarded as important. Because I do still hear a lot of, what do you have to be depressed about? You're a kid,
right?
You know, like there's some tangible reason to have depression. It's a chemical imbalance, you know. So it's just one of those things. Just recognizing. And also recognizing our own history, because usually kiddos with mental health diagnoses didn't just organically pop up with it by themselves. There's usually a family history of it. So being honest about that too. You know I have anxiety and depression. Like I've been diagnosed with it. So I am going to be looking for those things. Yes, I'm a clinical professional, but I'm going to be looking at those things through the lens of, is my son going to have some of that? Or, you know, there's still family history that we have to take into account too, and being honest about what that looks like for our kiddos.
So I'm just, this technology thing.
Yeah.
It's just, what do you think? What is the answer for us as moms? Maybe you don't have an answer, but what do? Do we just take technology completely away from our kids? Like how, you know, that's just something for me. I'm like, okay, what is the boundary? How do I teach a really healthy relationship here with technology?
It's like anything else. Full-on restriction is not the way. It is not the answer.
Right.
Because it will lead to more curiosity. It will lead to unhealthier abilities to have boundaries around it. So one of the things I say is, you know, technology is helpful. It's there for a reason. But having boundaries and having some limits on it, and also supervising. There's a meme I saw that's like, we don't supervise our kids online, but we supervise them like at the park and in person in these situations from these physical threats, but the threats online are much more incredible. I am of the mindset that no kiddo should have social media until they're at 16 or 17, because it's just not going to go anywhere good before that. And then also limiting access to internet, like having those controls around it. But also, like I said, using screen time as you can use it, but you have limits around it, and not letting people just do it without, you know, boundaries at all, because then it just becomes it can be an unhealthy habit. So it's just having those limits and boundaries around it, and then also just not giving them access to certain things until they're emotionally capable of dealing with it.
Right. And that's on us as moms.
Yeah.
You know, that we have to engage and we have to supervise what they're doing. And I know that's, you know, especially if we use social media, or technology is a
Yeah.
crutch to like take a break.
Yeah.
But
yeah.
we still have to be engaged.
Absolutely.
And what are they watching and digesting and consuming?
And what are
Yeah.
we as parents, how are we showing up? Because if we're always on our phone, but we're telling them that they can't be on their screens,
Exactly.
how hypocritical does that look? So we always have to be the role model in the situation and be we have to emulate the behavior we intend for our children to have as well. That goes for anything else. That goes for all things, food, nutrition, how we want to show up for other people. We are the role models in this situation.
Yes,
So,
absolutely.
yeah.
Okay, final question for you.
Yes.
So what's kind of a front line of if a mom suspects their child's in distress locally for where they can start?
Where
to
they
get
can start.
assistance for their kiddo.
So usually what I tell people is first line is always talk to your family's doctor because they can start the process of like referrals of if you need some additional referrals for therapy or if you want to look at medication management with someone like myself. There are organizations too if there's just kind of like a lot going on and you need help. Crisis Nursery is one of my favorites. I'm a little biased. I actually worked there many moons ago, but they do a lot of great work. I have patients on my caseload who have had to use their services acutely and also just needing some case management help to kind of get through some tougher times. So that's always a good resource. And just like I said, just reaching out to pediatrician. Talking through it because they can set up the appropriate referrals that are needed to get to the specialists in the situation.
Perfect.
Yeah.
Well, Yasmine, thank you so much for your time. Thanks for the work that
Absolutely.
you do. Our youth need it so badly.
Thank you.
And hang in there, moms. Keep showing up.
Absolutely.
It's exhausting. It's
a lot.
Day in and day out, but
absolutely.
Yep.
Absolutely. Thank you for having me.
Yes. All right. Thank you, St. Louis moms. We will catch you on our next episode of Moms of the Lou. Thanks for listening to Moms of the Lou. We hope it encouraged you and put a pep in your step and helped you get to know our community a little bit better. Be sure to find us on Instagram, st.louis_mom. You can find us on Facebook, St. Louis Mom. You can find us on our website, www.stlouismom.com. In case nobody else tells you today, you're a great mom and you're doing a great job. Chat with you next time.